Hello, I am Ann-Margaret Thomas at the Fred Memorial Library in Brooklyn, Maine. And today I'd like to talk to Philip Caper about healthcare for all. And Philip, thank you so much for joining us today. I'd like it if you could just give us a quick introduction and then we'll go into the questions.
Well, I will do that, but I'm just wondering whether you're not a little cold sitting out in front of the library on this nice winter day. I think you'll do well.
Thank you.
I'm Dr. Phil Caper. I'm a retired internist, and my passion for most of my career has been healthcare policy, because early on when I first became a doctor, I thought it was very important to think about for the doctors to think about healthcare policy, because it affects us a great deal, and more important, it affects our patients. So that's the field I've worked in most of my career. And I've become a strong advocate for a universal healthcare system, and one that puts the patient first, which is what we promised to do when we took the Hippocratic Oath when we first became doctors. So, and I think we need some very fundamental changes in the way our healthcare system works, or more accurately, doesn't work very well. So, first thing I see when I think about the healthcare system is that it's way too expensive. We pay roughly double the average of what all the other wealthy countries pay for healthcare. And that would be okay if we got better results. But we don't get better results. We get poorer results. The Commonwealth Fund, which is a foundation based in New York, does an assessment of healthcare outcomes, how successful the medical care system is in about 11 countries. And in their most recent report released last year, we come in dead last of all the wealthy countries, except for one category. So not only are we paying more than almost anybody else in the world, but our results are pretty bad. And I'd like to see that changed.
So Phil, what is Maine All Care?
Maine All Care is an advocacy organization that I helped found together with a few other doctors and other people concerned about healthcare about 10 years ago. And we're advocating for a universal, that is a healthcare system in Maine that covers everybody at the state level, because we don't think it would be wise to wait until the federal government deals with this problem. And when voters in Maine are asked what are their major concerns about that the politicians can do something about, healthcare always comes in near the top of the list. So there's a lot of concern among the public about our healthcare system, and we're advocating for a system we believe would be not only much less expensive, but much less complicated and confusing. So simplicity, I think, is a big selling point for fixing our healthcare system.
And how can we afford it?
Well, we're spending almost $4 trillion a year, or we'll shortly be spending that much on healthcare. And according to the most credible studies, roughly 25 to 30% of that is waste. And that waste is created by the complexity of our multi-insurance company, for-profit healthcare system. It's created by the fact that we are paying prices that really can't be justified and aren't the same in other countries for almost everything we buy in healthcare, whether it's drugs, prescriptions, medical devices, medical services. In order to be fair, doctors in this country, many doctors, make much more money than their counterparts do in other countries. And there's a lot of waste in the system. So when I'm asked how we can pay for this, We're already paying for it. We're just not getting it. We just have to reallocate the way we're spending money and spend more of it on effective healthcare and less of it on the waste in the system.
So why should we pay for the healthcare of other people if we're already paying for our own healthcare?
Well, actually, we already are through our tax system, through our Medicaid and Medicare systems. We're all paying for something that sooner or later, unless we're very lucky, all of us are going to require. So it's a question of being neighborly, in a sense, of setting up a system where we prepay for healthcare so it's there when we need it. And we don't have to go around and shop for it. It will be we'll be able to access it from cradle to grave, literally, just by virtue of being a resident of the United States or a resident of Maine in the case of what we're advocating for Maine. And what that does is to eliminate all of the data needed and the calculations and the pre-existing conditions and so on and so forth. It won't matter how old you are, what your occupation is, what your medical history is, where you live. None of that matters. Everybody would be eligible for the same system. And that's actually the way it works in virtually every other wealthy country in the world. So there are lots of ways to achieve that goal, but it would require really transformational changes to the way we think about healthcare. First of all, we have to stop thinking of it as a for-profit commodity and think of it instead as a public good, like our roads, like our public safety, like our libraries, and so on. And our government is funded, our legislatures, our governors, our politicians are funded as a public good. And healthcare should be a public good in the United States, as it is in every other country, wealthy country in the world. And even in countries that aren't so wealthy, provide healthcare to their citizens as a matter of a human right.
Now, some people would ask, sorry, Phil, but some people would ask you, is this socialized medicine what you're talking about?
Well, I love it when people accuse us of being socialist, because that's a term designed to halt the conversation. That's not the term designed to advance the conversation. And the reason people who are opposed to these kinds of changes want to halt the conversation is because the facts are definitely on our side. And as a matter of fact, most of the public is on our side. More than half, closer to 60% of the public is in favor of this idea. And somehow we still can't get it through the Congress, and we're having trouble getting it through the Maine legislature. And the question about that is, well, why is that the case if it's so popular? And there have been many studies done that demonstrate that a piece of legislation that is favored by the public is less likely to get through the legislative process than legislation that's favored by the large corporations. So the corporations and the wealthiest Americans who run the corporations have much more influence in our political process than the average citizens do. And I view that as a kind of corruption. So we have many ways a corrupt political system because we consider corporations to be people, and we consider money to be speech. And when you're facing that problem, people with the money and the corporate persons are going to have much more influence generally. But the problem with the healthcare system is becoming so severe and so widespread that the people's will may prevail in this case. The only question is not when it will happen. The question is, how bad does it have to get before the politicians feel the heat and have to provide what we want. And we're getting there slowly. I've been working on this problem for over 50 years. And, in the last 50 years, what I've seen is a healthcare system that was pretty much run by the doctors and the nurses. And the hospitals were viewed as the doctors' workshops. So the people running the hospitals did what the doctors thought was appropriate. And during that period, what I've seen is a takeover by our healthcare system by large, for-profit, publicly traded or hedge fund traded funded entities. So we've changed our healthcare system from one focused on healthcare and focused on putting the patient first to one that is focused on putting the bottom line first. And almost all of the problems with the healthcare system that we see, the high costs, the spotty coverage. I mean, 10% of the people in Maine still have no health insurance, despite the expansion of Medicaid and Medicare, so on and so forth. And almost 30% have inadequate health insurance. They think they're well insured until they have to use the insurance. And then they find out what isn't covered. And it's almost impossible to know what isn't covered until you get the bill. And so and that's because we've been persuaded as a society to think market forces will work in healthcare as they work so well in other fields. And that just isn't the case. And the reason it's not the case is because the people who are now called consumers, we used to call them patients, they're now called consumers or customers, have no power. The people selling healthcare services, the doctors and the nurses and the hospital people and the medical device companies and the pharmaceutical firms have all the power because they have all the information. And even the best informed consumer can't predict what they're going to need or how it will be applied. So the whole notion of market-based healthcare, which is what the Affordable Care Act, otherwise known as Obamacare, is based on. So tinkering around with a faulty system is never going to fix it. It's sort of like having a house and cracks keep appearing in the walls and the roof keeps springing leaks and the electrical system keeps shorting out. And you can patch those problems up one at a time. But if the problem is a bad foundation and the house is sinking into the ground, that's not going to fix those problems. You have to attack the underlying pathology, which in that example would be the foundation. You have to fix that before you fix anything else. But market-based principles are very attractive to Americans. We love competition, we love choice, we love the ideas of free markets and so on. But in a system where the customer has no power, markets don't work. And healthcare is a prime example of that problem in our society. That's why we have to switch it from a system focused on revenues and profits to a system based on what's best for the patient. And that's what we're advocating. And Maine All Care is a group that's doing that. You can go to our website. It's a nonprofit entity. It's mainallcare.org. And there's lots more information there that will hopefully enlighten people about what needs to be done to fix our broken healthcare system.
So I guess my question to you is also, why not just let people choose a public insurance option if they want it?
Well, the problem with that is that actually has been tried. That the public option, which people are still talking about, was in the original Obamacare bill, but it was dropped because of resistance from the hospitals and the drug companies and the insurance companies. They didn't want a government subsidized, government run alternative. So instead, the Congress put in a system of co-ops. And we have one of those co-ops here in Maine. and many of them were created, but most of them are now out of business because the co-ops had to be not-for-profit. And as a not-for-profit, they could not engage in medical underwriting to nearly the extent the commercial insurance companies did. Now, what's medical underwriting? Medical underwriting is pricing insurance plans based upon the risk that somebody will actually need the services. And that's obviously common practice in all insurance. And that's what the insurance companies do. The largest department in any insurance company is the underwriting department. And the underwriters are people who price risk. So if you live in a floodplain, flood insurance is going to be more expensive. If you have a bad driving record, auto insurance will be more expensive, and so on. But the problem in medical care is that if you price healthcare insurance based upon somebody's likelihood of using the insurance, you're basically discriminated against sick people. And do you really want a healthcare system that discriminates against sick people? I mean, the whole idea is absurd. And it's so absurd that when people who live in a more rational healthcare system in other countries look at ours, they just scratch their heads. And a French friend of mine recently remarked to me, he said, "Philip, why are Americans such suckers to fall for such a dumb idea as using markets? If you markets are fine if you want to have 1,000 types of breakfast cereal to choose from, even though you only use 3 or 4 of them. But people love choice in this country, and we love competition. The problem with competition is what's the basis of the competition? If you have 2 hospitals competing with one another, each one of them wants to have the latest whiz-bang technology, the best doctors, so on and so forth. And they don't share resources and they don't share information. So hospitals won't disclose, for example, their prices publicly because they don't want to expose them to their competitors in the next town over. And that's just no way, to even pretend you can choose rationally about healthcare. So people trying to choose their healthcare plan. I was thinking of changing my healthcare plan last year, and I looked at the choices, and I realized what I knew intuitively. I don't know what I'm going to need next year. I have no way of knowing what's going to be provided. I have no way of knowing, even as a physician, what it's going to cost. So how can I make an intelligent choice about what kind of plan? If a plan is cheaper, somehow the benefits are less. I mean, that's just the way it works. And you have no way of accurately predicting how that's going to turn out. So the whole idea is faulty and has to be replaced by a system where the hospitals actually cooperate with one another, which is the way it was years ago. And I'm old enough to remember that. If one hospital had a very expensive machine, in those days it was CAT scanners and MRIs, they would share it and become a regional resource with other hospitals. But the hospitals now view each other as competitors. They're all chasing revenue, which means we now have a surplus of profitable services and a shortage of unprofitable services. So we're paying, and the unprofitable services tend to be the ones we need the most. We need more primary care physicians, like obstetricians and gynecologists, family practitioners, general internists, pediatricians. We need fewer specialists, but because the specialties pay so much more than the generalists get, we have many more specialists than we need and not enough primary care. And the same logic applies to the way we build facilities. We have lots of facilities for interventional cardiology, for oncology, for orthopedics, and so on, because they're the money makers in a hospital. And the mental health services the primary care doctors, the family practitioners are basically selling their time and their expertise. They're not selling tests and procedures. And selling tests and procedures is how to make money in medicine, not selling your time. So our system, because it's so focused on profitability and fee-for-service payment, is becoming very badly distorted by the economic incentives rather than what's best for the patient. And that's why people feel so uncomfortable with the healthcare system. You know, the average Mainer knows there's something wrong, but they can't quite put their finger on it. And that's because they've come to believe that what our system is normal. And it's not normal, it's aberrant. In fact, our language has even changed to reflect that. The people we used to call doctors and nurses are now called providers. The people we used to call patients are now called consumers. The things we used to call services are now called product lines. So the entire healthcare industry has adopted this mindset of commercialism and healthcare as a commodity. And that's, you know, has just invaded even the nonprofit sectors. The nonprofit hospitals, which thankfully are all of them in Maine, have come to behave as though they are for-profit entities and put the bottom line first. The most glaring example of that I can think of in Maine was in Maine General Hospital in Augusta, discontinued their diabetes clinic because it was not profitable. There was no shortage of diabetics. They turned 3,000 diabetics loose without a source of care. And when those people tried to find other sources of diabetes care, they found out there was only one endocrinology practice, which is the kind of people who take care of diabetics in the state. We're still taking new patients. So that's a glaring example of how this focus on profitability and money has distorted medical care. And it's also distorted the way we doctors think. The electronic medical record systems that most hospitals have now adopted, and incidentally, most doctors are now employees of larger entities such as Maine Health or Central Maine Health or Northern Light or others. And when they are employees and they're evaluated, according to the ex-chief medical officer at what was then called Eastern Maine Health Systems, they're evaluated on the basis of how much revenue they bring in. And most doctors didn't go into medicine to produce a lot of revenue for the hospitals. We like to think we went into medicine to help people, but it's getting harder and harder as an employee of one of those big systems to resist that. And the electronic medical record system that we're now required to use, really by the federal government, are geared to maximizing profitability. They could be wonderful clinical instruments and a real source of information about how to improve medical care. Instead, even the data collection process has been corrupted and upcoded, so the hospitals are paid more for a complicated procedure than they are for a simple procedure. And it's very easy as a physician to make something look more complicated than it is. There are 40,000 different codes we can use to describe clinical conditions. And there's a lot of room in there for creative coding, which results in an increased income and increased profitability by the hospitals. So this is a systemic problem, and it's a fundamental problem, which is why it's so hard for most people to understand what's gone wrong. But I think that what's gone wrong is the commodification and corporatization of healthcare in this country. We're the only country in the world that is comfortable with that kind of a model.
So you've identified how it's gone wrong, and we all, I think, have examples of things that have been frustrating in all of our healthcare experiences. Some people are asking about, will there be rationing and long wait lines, and will people lose jobs if this universal health care goes through? What do you say to that?
Well, of course there'll be rationing. We have rationing now, but our rationing now is based on ability to pay. If you have enough money, you can get anything you want, anywhere you want. But that's not what healthcare should be all about. So it'll be rationing, but hopefully it'll be rationing based on medical need and on ability to pay. You know, we'll always have finite resources, so we're going to have to ration. But given what we're already spending in healthcare, we could have, without any question, the best and most accessible healthcare system in the world if we spend our money more wisely. And that's what I'm advocating. That's what Maine All Care is all about. That's what's possible.
How can we as average citizens help to make some of these changes? It seems it's so entrenched. How do we ever change something that's so entrenched?
We like better politicians. That's the short answer. This has to be, the momentum for this kind of change has to be overwhelming public support. We already have a strong and majority public support, but this has to become an issue people vote on. And if they don't vote for people who will not do this, and this is doable, Maine All Care commissioned a study by the Maine Center for Economic Policy that demonstrate how we could create a universal system, that is a system that covers all Mainers without changes in existing federal law. In other words, creating a program that fills in the gaps that exist even in the most popular programs, such as Medicare and Medicaid, and certainly commercial insurance. One huge problem with commercial insurance and job-related insurance, that is insurance you get as a benefit of your job, was well demonstrated last year when people lost their jobs due to the COVID epidemic and lost their health insurance just when they needed it the most. So that's the problem with linking insurance to your job. And another reason markets don't work is not only because of the lack of information, but it's because in our market, which works, has to sell products that are affordable to people. And healthcare has become so expensive that only the very wealthiest people could afford to buy it on their own. It also has to be, markets require the ability for the customers, if you will, to make a free decision, a non-coerced decision that can't be forced into buying something. Well, that's not the care in healthcare. First of all, because of corporatizations, many parts of the state don't have much choice in who their healthcare hospital provider is going to be. And that's a problem. And we certainly are not always in a situation where we can leisurely can go through onto your computer and pick out the best price and the best bargain. I mean, if you're in an ambulance on the way to the hospital, you're not going to be surfing the net looking for who's running a special on CAT scans this month. And you're going to be afraid, and you're going to be really need the service, no matter what it costs or where you get it. So that's another problem why the whole idea of using market forces for healthcare just simply doesn't work. It's an absurd idea on the face of it. And most people, most of the so-called players in the health policy sphere don't want to even take this on because they think it's too big a problem to tackle, and it is a very big problem. And of course, the opponents have almost unlimited resources. When you put the hospital chains together with the drug companies and the insurance companies, you have an opponent with almost unlimited resources. And anybody who watches the Sunday morning talk shows, as I do frequently, there's one ad after another. It's either for a drug, a pharmaceutical, or even the best hospitals in the country, such as Partners, which is a Mass General and Brigham and Women's in Boston, is now running ads on the news shows bragging about their doctors and their latest technology and blah, blah, blah. Okay, or Dana-Farber is another example of a place where a lot of people get their cancer care. So, but it's not always possible, or it's not always convenient to make those choices. So the underlying pathology is the commodification, for-profit nature of our healthcare system, and using market forces just doesn't work. And I can't say that often enough. We need a system where everybody is qualified, and we need a system where hospitals cooperate with each other for the benefit of the patients, not compete with one another.
Are there any other states that are talking about this type of thing, like Maine All Care, or is Maine a leader in this idea right now?
Well, our motto is Dirigo, which of course, you know, we lead. I wish it were so, but it isn't. We're a member, Maine All Care is a member of a group called One Payer States, and there are 22 members in that group. So 22 states that are working on state level healthcare. New York has a viable bill, and the California bill, which is called AB 1400 for universal health care in California, just passed through the state assembly last week. So that bill is actually progressing through the California state legislature. And they're faced with the same obstacles we are. But it is possible. The question is, how much pain does there have to be on the part of ordinary people before we develop the political will to do it? This is not about legal issues. It is not about technical issues. It's about politics. And you might ask, why is this so hard to change if things are so bad? And there are a couple of answers to that. We have lots of barriers to change. One is the political barrier. And by political barrier, I mean, we live in a country where the Constitution makes it very difficult to bring about significant change. And we're seeing that with the gridlock in Washington right now. And the United States Senate was created to sort of cool things off, to make it hard to have a supermajority to get anything big done. And that's what the obstacle is now in terms of voting rights, healthcare reform, climate action, and so on. So our government is constructed to make it easy to obstruct changes, and to make it difficult, easy to obstruct changes and difficult to bring them about. That's just the way, because the founders were so afraid of centralized power, that is a monarchy, that they made it very hard and required a great deal of consensus to change. But that's difficult in healthcare because it's so difficult to understand what the underlying problem is. And the system is so complex that it's very easy to camouflage a lot of mischief behind the complexity. The complexity is the friend of the status quo. The former Secretary of State in the state of Maine was talked to our board a couple of years ago in Maine All Care in connection with a ballot initiative we'd like to see on the ballot sooner or later. And he stated, as a former legislator, he stated that the most feared and reviled four-letter word in Augusta was change. Okay, think about that for a minute. The most reviled four-letter word is change. Anytime a politician advocates for change, somebody's going to get mad at them. So politicians find it difficult to change things a great deal because it's politically risky for them. And what is the genesis of that? Well, one is the political issues I've just talked about, but the other is the cultural issues in America. We have a culture which celebrates independence and individual freedom and collective action much less. We don't like collectivism. You know, that's for the communists or the socialists, as some people put it. You know, real rugged Americans, we pull ourselves up by the bootstraps. Well, that was an attractive theme that was actually created in Hollywood during the 1930s and 40s and has taken hold as a fundamental foundational belief. But the elements of that resistance, cultural resistance, I made up a mnemonic to remember them because that's what doctors do, to remember a lot of stuff. But my mnemonic is AFIG, A-F-I-G, AFIG. So the A stands for apathy. We don't seem to have the kind of, if it's not direct, if it doesn't directly affect me, not my problem. And that's what I call apathy, lack of social solidarity that exists in most other wealthy countries. So that's one problem. The second one, the F, is fear of loss and anger generated by that fear of loss. So fear of income if you're a doctor, fear of freedom if your choice of health plan is taken away from you, fear that somebody who doesn't really deserve it will get something and you'll have to pay for it. That's a big one. And there's quite frankly a lot of racism tied up in that feeling. The I is for ignorance. The healthcare system is complicated, complex, and people don't really understand how it works. And ideology, the ideology that the free markets will solve all problems, and that the paramount, most important element of free markets is increasing shareholder value. And that was an economic theory that I hope is now on the wane. I believe it is. But for many, many years, many decades, we operated on the principle that shareholder value in a capitalist system is the most important thing. And, corporations, actually, there's some truth to that. Because if you run a privately owned corporation, you can decide how greedy you want to be. And, and that's the G of FIG is greed. If you're a sole proprietor, you get to decide how greedy you want to be. If you're an individual, you can do that. If you're the CEO of a publicly traded corporation or a hedge fund, your job is to be greedy. Your job is to maximize shareholder return. And all of us who are invested in investment funds of any kind want to see the return be as high as possible. So it's built into the model. It's not optional if you are running one of these companies. It's obligatory. Greed is obligatory if you're running a shareholder publicly traded company or a hedge fund. You have to reward the investors. And there are some moves being made by these for-profit companies to try to look as though they're worried about, the externalities they produce, such as damage to the environment and so on. But they don't really make much of what really drives them. And the way that managers of these companies are rewarded is return on investment. So this is why we need a structural change, and to get the commercial and commodifying elements out of healthcare. Doesn't belong there. And we'd all be better off, because even no matter how much money you have and how much you pay for healthcare, every time you interact with a healthcare system, you're being ripped off by somebody. I mean, that's just the way the system is structured.
Well, Phil, there's also a shortage of primary care physicians in Maine. I've experienced it. I know people who've moved here recently, they can't find a primary care doctor. And then other people I talk to, they don't have insurance. They either can't afford the insurance, or it's just so complicated. So if people go to maineallcare.org, will they get some helpful information that can help if they want to, if people have the time to become active about this? Will maineallcare.org have a venue for these people who have the time and energy to help change things?
Oh, absolutely. Absolutely. Yeah, as I mentioned earlier, we're going to try to get a resolve on the ballot next year, 2023. And we can always use volunteers who want to collect signatures, who want to write letters to the editor, who want to talk to their neighbors, who want to host, coffee clutches, parties to talk to their neighbors. This is a problem that people have to understand what the issue is and how we're going to be able to change it. And I'm confident that we can. Again, as I said earlier, the question is not when. The question is how long is it going to take, and how much pain is going to have to be inflicted before we're able to fix this problem.
And do you think that this problem that we've been talking about now for almost an hour, do you think that that's also why there aren't enough primary care physicians? Are they just?
Absolutely. There are two reasons, Ann-Margaret. Primary care is a tough job. It's a tough job because you're the interface between the sick patient and the healthcare system. And it requires actually a lot more intellectual work than some of the more specialized areas do, because you have to be able to diagnose and treat a wide range of illnesses. So it's a hard job. Your life is really belongs to your patients, not you. You don't get to schedule when they're going to get sick and so on. And of course, primary care doctors are paid half or maybe a third of what you can make as a radiologist or an interventional cardiologist or an orthopedic surgeon, who are the best compensated specialists in medicine. And you can have much more control over your life. So it really takes a lot of dedication and a lot of skill and hard work to be a primary care physician. And you're not really compensated commensurately for it. And more than that, the culture of medicine over the past 50 years has kind of glorified the technology-oriented specialist. That's the sexy stuff that really gets people's attention. And the generalists live in many ways a much less exotic life. So they tend to be looked down upon within medicine because they don't make as much money. We often value people by what's your income. The more money you make, the better person you must be. Well, that ain't the case. I can tell you that from personal experience. I ran an investor-owned company myself for 15 years. So I interacted with the business community and with the venture capitalists and the investment bankers and so on. And I think I understand pretty well what they value and how it works. And that works in a company which, can really rely on market forces that are working for their success. But healthcare doesn't do that, as I've explained earlier.
Well, we appreciate you taking the time today to talk to us on this recorded Zoom meeting so that we can get the word out and share information. That's what we're about here at the library, is sharing information.
Right.
We have a book list that you gave us when you did your summer talk outside here, which was really well attended. And we have the books. And if we don't have some of the newer books on the list, we can get them for patrons. And we're happy to do that. So I just thank you so much for taking the time today to talk to me about this topic.
No, it's my pleasure. And I hope it does some good.
Thank you, Phil. You take care.
Take care. Thanks.